If you had been informed that your aortic valve is not functioning properly and an aortic valve replacement is needed, you might like to know the surgery procedure. In this video, we are going to explain the general lines of aortic valve replacement surgery. There are 4 chambers in your heart which are called left and right atria and ventricles. Those chambers enable pumping the blood to your body. There are connections of these ventricles to the pulmonary artery and aorta and valves at the connection points. These one-way valves allow the blood flow in one particular direction only. When the heart contracts, the aortic valve opens and blood is pumped into the aorta. When the heart relaxes, it closes to prevent blood from leaking back into the chamber. The aortic valve normally has 3 cusps, in other words leaflets that open widely and close tightly. Nevertheless, it is observed that 1 to 2% of the people have 2 cusps instead of 3, congenitally. Due to several reasons, including congenitally, a leaking aortic valve may cause blood to leak back into the ventricle, or a narrowed valve may restrict the amount of blood passing out to the aorta. Causes of aortic valve regurgitation are congenital heart valve disorders, narrowing of the aortic valve, aortic stenosis, inflammation of the valves and heart chambers, rheumatic fever, other diseases, like Marfan syndrome, and some autoimmune conditions, traumas caused by accidents and injuries. After a while, a deformed aortic valve can cause the heart muscles to become enlarged and weakened. Patients may experience heart failure. Symptoms of heart failure are shortness of breath, chest pain, dizziness, heart murmur, lightheadedness, irregular heart pulse, swelling of the ankles, feet, and legs, and fatigue. In these cases, your surgeon might decide to perform an aortic valve replacement to restore the valve to normal function. Before you get anesthesia for the operation, an IV line will be placed in your arm for fluids and medications. And a urinary catheter will be inserted into your bladder. A tube will be inserted through your mouth into the windpipe, in order to help you breathe while you sleep during surgery. Once you fall asleep with the anesthesia, your surgeon will make an incision in your chest. The surgeon will then separate the sternum. After the pericardium, which is a thin sac that protects and lubricates your heart, opens, you'll be connected to a heart-lung machine where your blood flow reroute. This machine takes over the duties of your heart and lungs during the surgery. That means your heart has to be stopped temporarily. Once your heart stops, then the surgeon will carefully open the aorta, expose the faulty valve and replace it precisely. Then the aorta will be stitched. Later, the heart will be allowed to pump again and let the blood flow naturally in order to check the new valve's function. Then you'll be detached from the machine. Placing a pacemaker is a likely procedure for a while to ensure the heart maintains a normal rhythm. After surgery, you'll be taken to the cardiac intensive care unit where your vital functions will be monitored. You'll usually need to stay in hospital for about a week after an aortic valve replacement, although it may be 2 to 3 months before you fully recover. The risk of dying from an aortic valve replacement is around 1% in Turkey, whereas it is up to 3% worldwide. However, even 3% risk is much smaller than that of surviving chance with severe aortic valve problems. Consult Dr. Genetrix for your treatment to minimize the risk and maximize the success rate with best surgeons in high-tech clinics of Turkey. Because we are always here to help.